Hello everybody, I am Dr. Poonam Negi, consultant intensivist. Today we'll discuss about subarachnoid hemorrhage. We have seen all the neural infections, we have learnt even about acute meningitis, chronic meningitis, a little about autoimmune meningoencephalitis. So today we'll deal with another spectrum, that is subarachnoid hemorrhage, which has got very high mortality, very high morbidity, and has got a complex mechanism of action and requires intensive neuro support or a neurocritical care support. So it's basically a neurovascular emergency which definitely requires urgent intervention like any of the CNS issues or CNS emergencies. The time of onset of your ictus, that is the time of onset of your symptom, to the intervention which we do are very critical here. The mean age of presentation is usually around 45 to 55 years of age. So you have a very critical age limit there, wherein a person has got another 20 to 30 years of longevity, and the mortality is quite high, that is around 13%, and is definitely dependent on the place where the patient presents, the time of intervention, the quality of intervention, and your post-intervention care. So what is a subarachnoid hemorrhage? Subarachnoid hemorrhage is nothing but a rupture of an aneurysm under your arachnoid space or your subarachnoid membrane. So it can be of two types, an aneurysmal SAH or a traumatic SAH. Traumatic SAH is not having so much of implications or does not have so much of morbidity and mortality, but an aneurysmal SAH has definitely got higher implications. So what is an aneurysm? Aneurysm is nothing but a dilatation. So you have a vessel and then you have a dilatation in the vessel wall. That is, your internal elastic lamina and your tunica media are dilated, or sometimes you have the loss of the tunica media and only your elastic lamina is getting dilated. So based on the way it is dilated, it can be a saccular aneurysm where it is like a balloon form of aneurysm, or a fusiform aneurysm where it is adequately dilated, or it could be a ruptured aneurysm. So you have to remember there is a considerable amount of blood flow in a high MAP or cerebral perfusion pressure going on through this, and this rupture of this blood flow can be extremely harmful. So wherein do you see subarachnoid hemorrhage? The etiology can be familial or genetic, where you are predisposed to aneurysm, and so mostly it is common at your anterior circulation or your posterior circulation at the vertebral and basilar arteries, or in your anterior circulation at the level of your circle of Willis. It is also common in your genetic diseases like adult polycystic kidney disease, Ehlers-Danlos syndrome, Marfan syndrome, or neurofibromatosis type 1. And what are the risk factors where you get these aneurysmal rupture? Obviously, the most important is hypertension. So increase in your pressure in your blood vessels causes these aneurysms to rupture. Then it can be your smoking abuse, usage of cocaine, to certain extent obesity, and also the size of your aneurysm. That is, studies have shown that your aneurysm of more than 7 millimeters of size is more prone to rupture than your aneurysm of size of less than 7 mm. Other than that, you can have other critical factors like raised ICP or your aneurysm to the blood vessel ratio. So this is your blood vessel, and to that blood vessel you have a very high dilated aneurysm. So they calculate the ratio diameter of the blood vessel as well as the diameter of your aneurysmal part of the blood vessel, and this higher aneurysmal to blood vessel ratio is also prone for rupture. Other than that, there have been certain incidences where they have seen the usage of OC pills or usage of these progesterone induced pills. All these things have also shown to be having a smaller implication in these aneurysmal rupture.